Welcome back to the Deep Dive. Today we're digging into something pretty significant, a recent presidential executive order. Yeah, one of you sent this over, and it's dense but really important. It's all about transforming the fight against pediatric cancer. Our mission here is to cut through, the legal jargon and the bureaucracy to see what the U.S. government is actually doing with artificial intelligence here. And it's not just tinkering around the edges. This seems like a mandate for a fundamental shift in how research happens.
It really is. And we have to start where the policy itself starts with the stark reality. Pediatric cancer is the #1 cause of death from disease for kids aged 1 to 19 in the U.S. That fact alone is, it's why this is getting that high-level attention.
And there's this context that makes it even more urgent, right? The long-term picture isn't great.
No, it isn't. The sources we looked at point out that the number of new cases has actually gone up by over 40% since 1975.
40% since 75, wow. So we haven't been consistently winning?
Exactly. That trend, that worrying increase over decades, is really what this executive order is trying to break. It's like an official statement saying, look, what we've been doing for 50 years isn't enough anymore.
So the big plan involves mobilization. This EO, dated September 30, 2025, it explicitly leverages AI. It seems to be about fundamentally changing the approach, and it builds on things already in motion, federal efforts already underway.
Right. It's not out of the blue. This fits into a wider push from the administration to drive innovation using technology.
Mm-hmm.
But this order specifically targets AI for this very vulnerable group.
And AI isn't just being dropped into a vacuum, it's leveraging an existing structure. The Childhood Cancer Data Initiative, the CCDI, that started back in 2019, right? And it wasn't small change like $50 million a year for 10 years.
That's right. A $500 million commitment over a decade. And that money is crucial because, honestly, the big challenge now isn't just generating data. We generate tons of it. The real bottleneck is organizing it, making it uniform, making it accessible. The CCDI is meant to be that foundation. Think of it as this huge, standardized library of information.
Okay, a library. And now that AI is being told, essentially, go read everything in this library and figure it out.
Pretty much. But you need coordination for something that big. Yeah. And that's where the MAHA Commission comes, in the Make America Healthy Again Commission. Their job is to get all the different agencies working together on this AI push to unlock better diagnoses, treatments, cures, even prevention.
And who's on this commission? It's HHS, Health and Human Services.
Yes, HHS. And the President's Science Advisor, the APST. Those make sense.
But then there's the Special Advisor for AI and Crypto. That one jumped out at me. Why crypto in a pediatric cancer initiative?
Yeah, that's interesting, isn't it? It likely signals a couple of things. First, they might see blockchain or similar tech, the crypto part, as important for data security. Like, how do you prove this incredibly sensitive patient data is authentic and hasn't been tampered with as it moves between researchers? Blockchain offers potential solutions for that kind of data provenance.
Ah, okay. So it's about trust and security for the data itself. Makes sense.
Exactly. And second, it might suggest they're thinking about maybe novel funding or coordination models. Not just the usual federal grants. It shows they're coordinating not just the medical side, but the cutting-edge tech deployment and security too.
So pulling it all together, the EO is basically saying our current healthcare system is too fragmented, too slow, relies on old tech. And that inertia, that slowness, hurts the fight against cancer and dealing with the long-term health issues survivors face.
Precisely. And the EO's answer is direct. Prioritize investing in science that uses AI and build these top-tier data sets right now. No waiting.
Okay, let's get into the specifics then. Section 2 seems to be, as you might say, where the digital rubber meets the medical road. It lays out 3 really concrete areas where AI is supposed to immediately speed things up at the CCDI.
Right. The first one, Section 2A, tackles that core data problem we mentioned and how it relates to clinical trials. The challenge, especially with rare childhood cancers, is data being stuck. It's in dozens, maybe hundreds of different hospital systems, all formatted differently. So the policy says, use AI to fix the data infrastructure, consolidate it from all those places, and get it ready for AI-ready analysis.
AI-ready. So basically, making it speak one language the AI can understand. You can imagine, for a parent or a doctor, how frustrating it must be knowing the data exists but isn't usable together.
Exactly. It's about unlocking that trapped potential. And then, crucially, use that unified data pool to get better at selecting kids for clinical trials.
Ah, okay. So instead of someone manually sifting through files, the AI can look at a child's specific cancer genomics, their history, where they live, and instantly match them against all the available trials across the country.
That's the goal. to dramatically cut down the time it takes to find the right trial for the right child, getting access to potentially life-saving research much, much faster.
That alone would be huge. What's the second focus point?
Section 2B is maybe the most technically ambitious. It's about analysis, prediction, and biomarkers. Essentially using AI to understand these incredibly complex biological systems better than we ever could before. The big aim here is radically improving predictive modeling.
Okay, predictive modeling, so forecasting things. And it mentions using multi-omics data and imaging data to find biomarkers. Let's break that down a bit. What's multi-omics?
It sounds complicated, but think of it like layering different types of biological information. You have the genome, the DNA. There may be proteomics, the proteins, metabolomics, the body's chemical processes, maybe environmental factors. Each one is a massive data set on its own.
What?
Multi-omics means looking at all of them together. We can generate this data easily now, but seeing the meaningful connections across all those layers, that's incredibly hard computationally.
Right. Too much for a human brain or even standard computers to really correlate effectively.
Exactly, and that's where AI comes in. It can sift through that complexity, looking for hidden patterns across all those omes plus imaging scans.
And those patterns become the biomarkers, like flags or signals.
Precisely. Novel markers that help doctors diagnose earlier, predict how the disease might progress. That's the prognostic part. Or choose the best therapy. That's the therapeutic biomarker part.
And the predictive modeling goes beyond just, will this work? I saw mentions of predicting long-term effects.
Yes, that's a huge part of it. Imagine an AI being able to analyze a proposed chemo regimen and predict the likelihood of that child developing, say, heart problems 10 or 15 years later because of it.
Wow. Based on their specific biology and the treatment details.
Right. That allows doctors to potentially adjust treatment today to minimize long-term harm decades down the line.
Yeah.
Optimizing not just survival, but the quality of that survival. That's something we just can't reliably forecast now.
Okay, that's incredibly powerful. And the third focus area, Section 2C.
That one circles back to clinical trials, but focuses on improving the trials themselves. Better design, better access, better outcomes overall.
How does AI help there? It mentions incorporating multimodal data.
Multimodal just means different types of data. So combining the imaging scans, the doctor's written notes in the electronic health record, maybe data from wearable sensors, lab results, everything. AI can analyze all that combined information to squeeze the maximum insight out of every single trial participant.
So it leads to, what, more efficient trials?
Hopefully, yes. Better recruitment, finding the right participants faster, streamlined administration, maybe even identifying earlier if a trial isn't working so you don't waste time and resources. And ultimately, getting clearer, more reliable answers about whether a new treatment approach actually works.
Fewer failed trials, faster answers. Makes sense.
Right.
Okay, so we see the plan for the AI itself. But what about the support structure, the funding, the rules? That's in Section 3, right? The MAHA Commission's role.
Yes, Section 3 gets into resources and bringing others on board. The MAHA Commission is tasked with prioritizing strategies for two key things. First, interestingly, is increasing investment from existing federal funds.
Existing funds, so not necessarily asking Congress for a big new pot of money, but redirecting what's already budgeted.
That seems to be the implication. It signals this is a top administrative priority, like telling agencies, this AI initiative for pediatric cancer is so important, find the money in your current budgets now.
That definitely suggests urgency and using administrative power to move fast. What's the second strategy?
Encouraging the private sector, pharmaceutical companies, tech companies to jump in and use their most advanced AI tools to help find cures. It's framed as creating the platform and the data environment where public-private partnerships can accelerate research. A national call to action, really.
Okay, so mobilizing government and industry. But that leads to a really crucial point, especially when you talk about consolidating all this sensitive patient data. Section 4 deals with that, right? Data sharing and patient control.
Absolutely critical. This is probably top of mind for many listeners, especially parents. The Secretary of HHS is specifically mandated to weave AI innovation into the ongoing work on interoperability.
Interoperability, making sure different hospital computer systems, the electronic health records or EHRs, and the insurance claims data can actually talk to each other.
Exactly. Because the AI can't work its magic if the data is locked away in incompatible digital silos. That interoperability groundwork is essential.
But here's the key part, the privacy aspect. The order says this must be done while explicitly ensuring patients and parents control their health information.
That caveat is huge. It acknowledges you need to aggregate data for the research to succeed, but individual control and privacy can't be sacrificed. Parents have to remain in the driver's seat regarding their child's most sensitive information, even if that data, anonymized or aggregated, is helping save other kids.
So how do they ensure that control? How does that work technically?
Well, the Secretary also has to finalize specific interoperability standards for how patient data is used with AI. This includes rules for both structured data, things like lab values in neat columns, and unstructured data, like the free text notes a doctor writes. The idea is to build the safety and privacy rules first, before the large-scale AI analysis really ramps up, ensuring data exchanges are secure and comply with privacy laws.
Setting the guardrails before the high-speed train leaves the station.
That's a good way to put it. Trying to be proactive about the ethical and privacy challenges in this fast-moving tech space.
So when you step back and look at this whole executive order, the big picture isn't just about finding, say, one new drug. It feels much bigger.
It really is. It's about using AI to fundamentally overhaul the entire infrastructure of pediatric cancer research. From standardizing how data is collected in the first place,
to designing smarter clinical trials, predicting individual patient responses, managing long-term effects. It touches everything.
it's quite a comprehensive vision, and it shows a sophisticated understanding that you need these advanced computational tools for today's complex data, like multiomics. But also, crucially, that the ethical side, the patient and parent control over data, has to be baked in from the start. It can't be an afterthought.
Yeah, that balance seems key. And the whole thing is driven by that urgency, that startling 40% rise in pediatric cancer cases since 1975 that the EO highlights. Which leaves us with maybe a final thought for you, the listener. If the government sees AI as necessary to tackle something as complex, as data-heavy, and as emotionally charged as pediatric cancer research, and they're mandating this kind of top-down, rapid infrastructural overhaul, what other areas in our lives, maybe our workplaces, that currently rely on slow, fragmented, or outdated technologies might be next? Where else could this kind of government-backed AI transformation be applied? Something to ponder as you go about your week.